Illinois could become the next state to legalize physician-assisted suicide. State Senate Bill 3499 allows doctors to prescribe death-inducing pills for patients diagnosed with a terminal illness. But life leaders warn if it becomes law, it could eventually open the door for even more radical legislation that would expand assisted suicide to patients suffering from depression or health problems. Dr. Carl Benzio, a psychiatrist who serves with the American Association of Christian Counselors, weighed in on physician-assisted suicide during an IFI forum at Grace Fellowship Church in Oak Forest.
So Hippocrates in 486 BC came out with the Hippocratic Oath. The Hippocratic Oath, he talked about physician-assisted suicide because people were coming to somebody who was a slave owner that got a slave pregnant, or a slave was had a broken leg, and the slave owner would give Hippocrates or the doctor $20 to kill that person because they cost me more money. It's a lot easier to just kill that person. And finally, people were afraid to tell their doctor anything because I don't know if that doctor's going to kill me because that information will get back to my master. So now there's a lack of trust. Well, it's vital for a patient to be able to trust their doctor to give them information that I need to know to be able to treat them as best as possible and maximize their health and their opportunity. So when a patient doesn't trust me, we're already starting on a bad foot to be able to, for me to do my job as best as possible. So whenever we have physician-assisted suicide, now patients aren't trusting their doctors. Is that doctor going to kill me? Are they not going to kill me? What's going to happen? I can't stop a person from killing themselves. You know, in the end, that's between, but I can try to put them on a commitment. I can try to give them all kind of helpful things. I've treated patients that have attempted suicide, jumped off a bridge, shot themselves, drank Drano, and wore out their esophagus, and now they have to have a feeding tube for the rest of their life. But now they're glad that they lived, and they see the amazing thing that God can do with them. So we can't predict the future, but we don't want the healthcare provider to be somebody that is jumping in, doing harmful things to patient, and that's what society starts to see healthcare providers as, a harmful part of our society, instead of, hey, these are healers, this is where you go to prolong your life, to get help, not to kill life. And so whenever they try to pull doctors into it, I think they're just trying to validate their poor position by bringing in somebody to bridge that gap, sort of be a line of security blanket in their maladaptive kind of policy.
Dr. Carl Benzio is the co-founder and medical director of the Honey Lake Clinic, a Christian-based residential mental health treatment resort in Greenville, Florida. Call your state lawmakers. Ask them to vote no on assisted suicide, State Senate Bill 3499. For names and phone numbers, click Officials Finder at illinoisfamily.org. And please support the work of the Illinois Family Institute. All donations are tax deductible.